My name is DymenM Interview, and this is Ms. Stephanie McNeil, my mentor for my senior project. What about being an athletic trainer that you want to pursue?
Being an athletic trainer is extremely exciting, especially for a person who is very competitive. And that's what I was. I played every sport and I played them well. However, I was inspired by this young man, or this man, one of my instructors at Shaw University. His name is Dr. Palmer, and I was asked recently, who told me that in order to be a good athlete, you must know how to take care of your body, not just your body, but perhaps other folks' body, especially if you're a good team member too. With that in mind, I said, well, I'm interested in what you have to say, and I'm ready to hear what you have to offer. And so I spent numerous days and nights in the athletic training field. My discipline, aside from my regular undergraduate discipline, learning how to be an athletic
Were
trainer.
you still playing sports while you were taking it?
Yes, extremely. I ran track all year round. I played volleyball, basketball, and softball. But I was still in that secular. Like, for instance, if a person needed physical training or therapy, because I was already equipped to do so, I was right there for my teammates and was allowed to do so.
Okay. In your opinion, what is the most difficult aspect of being an athletic trainer?
I would say the most difficult aspect of being a physical trainer is that there are just simply some things that females cannot do, that guys can do, especially when lifting or maneuvering and dealing with large athletes. So some sports for me are limited, and then I have a personal reason for being limited due to some personal issues. So that doubles the limitation upon which you can train or help most athletes that are, definitely large in size or quantity. Now, to overcome that, if it wasn't for my personal medical limitations myself, I would tell women that, you need to be extremely physically fit.
What is the level of difficulty juggling this career and all other things in your life?
Time management, especially when it comes to physical therapy and or training. If there was an emergency or a situation that required your assistance as a physical therapist, you need to stop and have to stop and really focus your attention on that. Well, with that not being my main career, that's really even more intense and hard to do. Especially when you have to keep your cool if in the event there's a person or athlete or whatever your gamut is, whomever you're working with, that really needs you, and you have to assess the whole situation. You have to be cool and calm.
Is it hard to step outside of yourself, like at that instant?
I think if you do it well and you do it enough and you're really comfortable, it actually becomes extremely exciting, and you're in control. And then what I realized, you said hard to step in. It's hard to step out after I've helped someone, and I come back out of that role. I literally have to take that sigh of relief, like, thank God for every situation, because it was His training and allowing me to do that helped save a life.
If you could become a pro athletic trainer on the professional team level, would you, and why?
I would definitely love to become a pro athletic trainer, and it's not just for the money. They actually have a glam life. They really get involved with these people and deal with people at all kinds of levels, and that's what I've always wanted to do, is help somebody. So yes, and of course the money that they make is a bonus. That's definitely a plus. And if you're an athlete and you get to travel with athletes or be around athletes, that would be phenomenal. And it doesn't necessarily have to be a male sport, just knowing that you have this positive role in these people's life. And to me, you're just as important as a coach. That would be phenomenal for me.
What is one word of advice that you would give to someone pursuing this career?
Definitely take as many college courses and courses as you could. It's never enough, and you can never say that you've not learned enough, because they're always going to require you to upgrade your CPR, your first aid, your training, your vernacular. Things are changing, but you always have to keep learning. So therefore, I would ask students, or someone, if they were my mentor, like yourself, to just constantly pick up on things, constantly view films and view cameras of types of breaks. Know your profession, know it well, because someone's putting their hands, their life in your hands, and that's phenomenal.
All right. Well, Ms. Mel.
Thank you.